Greetings, everyone. Good afternoon. We'll get started in just a minute. We're just letting folks join, so we'll get started in just a moment. Very good. Well, welcome. Good afternoon. Thanks for joining us this afternoon for this town hall. As you know, we've started in the last week or so doing town halls specifically for each class. They've been going quite well, and we want it to be an opportunity for us to share with you updates that are particularly pertinent for your group, but also to hear your questions. So the format of these, in addition to being just for your class, is a little bit different. It's designed where you'll actually be able to ask your questions directly to us. What we'll be doing is we'll be first hearing some welcoming remarks from Dean Martin. Then I'll be giving some sort of general directions for how we ask and answer questions. We'll then start with a little bit of some questions that came in ahead of time that either I'll answer or I'll ask my colleagues, other deans, et cetera, to respond to. And then we'll be opening it up, and I'll say more about that in a few minutes about how we'll take your questions today. We have about an hour. The session is being recorded, so if you happen to need to leave early or come late, or you want to watch it again, or you have classmates who missed it, it will be recorded and made available for you to view at a later time. So again, I just want to thank you for joining this afternoon and invite our Dean, Dr. Kelsey Martin, to make a few remarks.
Thank you, Dr. Braddock, and welcome and thank you to all of the MS1 class. I am so aware of what an unexpected time for all of you this must be. This must not be what you anticipated when you came as first-year students last August. At the same time, it's really it's your time, right? I mean, it really is your time in the history of medicine right now. We are facing a pandemic that is changing the world. It's certainly changing the way medicine is and likely will be practiced. It's a time where biomedical research holds just enormous promise for humanity, for society, and I recognize how hard it is for each of you individually, how hard it is for each of us individually, and at the same time, I do feel that it's a moment when it is the calling you've chosen for your career is more important than ever. And I, again, am incredibly grateful to all the students who've come forward in a myriad of ways to volunteer to help in any way that they can, in any way that you can. And I'm grateful for that. I'm committed to working with your amazing staff and faculty who want to make sure that you get through this with a profound education, and that we are able to help you really leverage all of your talents and your skills and your hopes and your dreams as physicians in training. And that we're here to do whatever we can to help in that regard. And so with those comments, I'm going to turn it back over to Dr. Braddock.
Thanks so much, Dean Martin, for joining us today. We know you're incredibly busy, but it means a lot to have you join and make some comments to the students. I also wanted to invite Dr. Lee Miller, who, as you all know, is our Dean for Students and well known to all of you, to see if Dr. Miller would like to make a couple welcome remarks.
You're mute, Lee.
Sorry about. Well, I was saying hi there, folks. A warm hello to the first year class. I'm sorry that we don't have the opportunity to be hanging and gabbing in person, but it's been a real highlight to be able to do that with many of you on an individual basis, and I'm coming to that. This is clearly such an incredibly challenging time for all of us, and it certainly creates a tremendous amount of anxiety in different arenas, in different ways for different folks. And I think that the uncertainty, the unanswered questions about how long this is going to last, the duration, creates anxiety. And we also recognize that there may be very significant financial stresses as a result of the pandemic, and many of us are worried about our families. And very significantly, we're worried about the well-being of our loved ones, most especially the elderly. So it's really important that we want you to know that we're here from you, and there are so many resources for support. The Behavioral Wellness Center has sessions all throughout the day. They have evening hours. They now have Saturday sessions with telemedicine, telehealth, the financial aid team. We have, for those of you who are facing significant financial circumstances, I want to hear about it. We may have some resources that we can help you with through the Physicians Aid Association. So reach out to me. Please reach out to all of the assistant deans, the leadership of Prime LA, MSTP, and Drew, the Behavioral Wellness Center. And one of the highlights for all of us in the dean's office is we're going from Zoom meeting to Zoom meeting from Zoom meeting, sometimes from 7 in the morning until 9 at night. And I'll tell you, for me, and I know for many of us, one of the highlights of all these Zoom calls is having a one-on-one time to connect with students. So for our sake, please continue to reach out and do that. No, we really do enjoy that. Now, passing the baton back to Dr. Braddock.
Thank you, Dr. Miller. And I just would maybe add to what Doctors Martin and Miller had to say. It's we've all been thinking a lot about about all of you. Wasn't that long ago that you were here? A year ago for Second Look, and then matriculating and eagerly starting your career as future physicians, only to have this sort of a situation happen upon us. So just sharing a couple of reflections before we go to our questions. I certainly have been thinking a lot about how over the course of a career as a physician, the number of times that we're tested, and tested meaning where our resolve to the things that brought us into the profession, the things that are important to us personally and professionally, that our resolve and our commitment to those things are tested. And your commitment to becoming physicians and staying on that path has been tested. And we're so grateful and really proud of how you're meeting that test. And there's a lot of pride and reflection on all the things we're seeing. Some might call it heroism. Some is calling it people who recognize the magnitude of the moment. I had a mentor who would always talk about trying to recognize the magnitude of the moment and rise to that moment. And I think about all the examples that I've seen. Two come to mind. One was when the hospital is staffing the unit for COVID positive patients. Residency directors trying to figure out which residents to assign to that unit to work with all the COVID positive patients, and goes to the residents and said, well, we decided we'll take volunteers. And out of 50 residents in that particular group, 48 volunteered. And those residents are taking care of those patients. They're going home to families, and they're stopping in the garage and stripping down to their skivvies and taking. They're stepping up to the magnitude of the moment. Many of you are stepping up to the magnitude of the moment to what you're doing in volunteer work. You're helping with childcare and personal services, the group that's assembling face shields, all the things you're doing both for our healthcare workforce and for others, and I'll come back to that in a moment, are recognizing the magnitude of the moment. So reflecting on that, but at the same while, as Dr. Miller said, realizing that each of us is affected by the magnitude of the moment, and giving ourselves and one another the support and care that we need. The second comment before I move on would be, in thinking a lot about this, I came across a Tolstoy quote, and Tolstoy said that the two most powerful warriors are patience and time. Patience and time. And when we're tested in moments like this, it tests our patience. And our patience and time will allow us to move forward. So when we reflect on this time and how we were tested, we can be proud of how we responded. So Remember those two most powerful warriors, patience and time. So next, we're going to first cover some questions that came in ahead of time. Before doing that, I want to just say a couple words about just sort of the choreography here. So what we'll be doing is we'll be addressing a few questions and then saving the balance of time for your questions. When we get to that point, and I'll remind you when we get there, we have a way in which we'll have you raise your digital hand on Zoom. We actually have a slide to demonstrate that. What you'll see here is the way you actually raise your hand. Near the bottom of the screen, you'll see, as you see there, the participant tab. If you click on that, it will pop up and you'll see your name, and then you'll see that little, where the cursor is now, where you can actually click on that and raise your hand. As we get to that point, I'll signal when we're doing questions. One of our staff, Ashley Seymour, will be monitoring that. We'll develop a little queue of questions. And then we'll answer the questions in the order in which they're asked. But again, we'll remind you that when we get there, but just wanted you to know that's how we'll manage the question and answer. So let's talk about some of the questions that have come in from you ahead of time. One of the things that several students have asked me individually, but also came in our questions, was talking about how and what UCLA Health is doing, not just to manage our patients here and support our healthcare workers here, but to partner with other community-based institutions and partners, particularly those who serve underserved communities throughout Los Angeles. And I wanted to say a couple words about that. The two main areas that people have asked about are COVID testing and personal protective equipment, or PPE. So the first is to say that UCLA actually is partnering with our partner institutions, particularly LA County, around having some testing capacity offered to those institutions. That could have been a wonderful partnership. One example of that is, many of you have probably heard that and one of the ways to try to manage exposures, COVID exposures in surgery, is to test every patient who's going to surgery preoperatively for COVID-19. That allows the appropriate PPE to be deployed, so for the anesthesiologists, the scrub nurses, the surgeons, everybody in the operating room, to know the level of risk. The other thing we've been doing is really having lots of conversations regularly with our leadership at those institutions. So, for example, I think you heard maybe in an earlier town hall from Dr. Kate Perkins, our Dean for GME, meets on a daily basis with colleagues from LA County, and they talk about the different approaches of the institution, trying to align and have common approaches. Out of that conversation came the idea that we should, to the greatest extent possible, all be doing this preoperative testing. So once the county hospitals felt that that was an appropriate place to be, and we're trying to find the right amount of testing to be able to support that, so UCLA is providing testing support to the county hospitals to enable them to do the same level of preoperative testing that we're doing here, just as one example. The second area that folks have asked a lot about, as I said, is PPE and access to that for some of our healthcare systems, community-based partners. UCLA Health does share PPE with some smaller community-based organizations. With regard to questions I've been asked and have come in on our questions about the county hospital, it actually turns out, and again, this is something that's I think important for us all to know, that the county hospital actually has its own supply chain, its own distribution system for personal protective equipment. It's part of a larger kind of disaster preparedness activity that's always happening at the county level, and they actually deploy, whether it's ventilators or personal protective equipment or what have you, throughout the county. If you're interested in learning more about how they're doing, I would invite you to look at they actually have on the website a report that shows. So I'm actually going to see if I could pull it up here and show you. This shows a dashboard of what county hospitals are, how they're doing with regard to beds and et cetera. This is actually available if you Google LA County Health Services COVID-19 dashboard. This is what you'll find. It shows bed availability, and then it shows this on personal protective equipment. And so this just shows that the green shows when they have supply that's 30 or more days. The yellow is when they have a supply of 9 to 29 days. So they're monitoring this on a regular basis. And what they reported to us that they do is then they draw from that county store of PPE to be able to provide that for their folks. So again, I just thought I'd share that because a lot of folks have asked me about it. When we've talked to county leadership, this is what they tell us, is that they have a mechanism to provide that PPE. So with that, some of you might be wondering, well, how is it that we're hearing from colleagues at the county hospital or other settings they don't have adequate PPE? I don't know the reason, but we do know that the practice of distributing PPE has changed dramatically at each of our sites, not only there, but also here. So I can tell you from my times on the wards, if I ever needed an N95 mask, I would just walk up and down the hallway till I found a box of N95 masks and take one and use it for the patient for which it was indicated. Well, unfortunately, in the early phases of the COVID-19 outbreak, there was a lot of loss of PPE. People were taking maybe more than they needed, who knows what, but every health system has started to take the PPE, the masks and things, and not leave them just lying out in the hall, but put them in a central distribution spot for someone on that unit to distribute to folks. So when someone arrives in that unit, if they don't see it out in the hallway as they usually do, they might have the impression that there's a shortage. I'm telling you all this not to belabor the point, but just I want folks to know that our partnerships with LA County, with the VA, with Venice Family Clinic, with Charles Drew and MLK Community Hospital, with all of our partners are incredibly important to us. And we have regular conversations with them about the shared challenges we have, and we work very closely together. So I wanted to spend a minute on that just to make sure that folks had a flavor. Another question from that was common is about what to expect for next year, and particularly around Block 6, and the question of whether we'll be doing remote education or in person. And as both Dr. Martin and Dr. Miller said, we don't really know. Obviously, we're following, as are you, the trends of the pandemic. We're following the instructions from leadership at the state level around stay at home, et cetera. And we're also monitoring our own availability of PPE and testing, et cetera, et cetera. But for you, I would say at this time, it would be our intent, our desire to be able to resume normal instruction when you start Block 6. However, we're also planning to be able to have instruction begin remotely if we need to. If that seems like a wishy-washy answer, it's only because we want to be prepared for either eventuality. We'll be monitoring the situation daily as we do now, and keeping you updated as regularly as we can. But our intent would be, all things being equal, if we are able to resume instruction, we'd love to be able to do that, but we're preparing to do remote instruction if that's needed. And of course, you know what that means now in terms of the lectures, the labs, PBL. We're very grateful to the faculty who've been very creative in thinking about clinical skills, activities, and how to do those, even though it's not the same as being with a live patient, different ways to do that. The third question of the general ones I'll address, and then I think we'll move into your questions, had to do with a very specific thing about clinical skills. And we know that you've gone through that in Block 4 and now starting up Block 5. We've been very grateful for again, some of the creative efforts of the PM&R residents who are demonstrating exams, and glad that that's there. But we also realize that that's not the same as being able to practice a physical exam. We've probably already heard by now from the Block 5 chairs about their plans, and certainly we're continuing to talk with them as well as the Block 4 chairs about what activities we can do in the future to make sure that we're preparing you to be fully comfortable and confident and ready to go with your physical exam skills. So that's the current state of things with regard to the current block as well as Block 6. So now I think we'll move on to, actually I was going to ask, before we move on to questions, I wanted to ask Dr. Ed Ha, our Assistant Dean for Curricular Affairs, or Zaldi Tan, if you wanted to make any further comments, Dr. Tan or Dr. Ha, about clinical skills training.
Zaldi, you're on mute.
Or
Apologies.
Yeah.
Sorry.
Yes,
Can you hear
thank
me?
you.
Yes. Greetings to all of you, and as Dr. Braddock said, we've been working actively with your block chairs, and we did that for block 4, and now with block 5, and now if we need to, we're going to be working with block 6. It's definitely in our plans to give you the clinical skills that you need to practice once we have the ability to do so. In the meantime, we're making do with sort of the virtual experience, but rest assured that we have plans to give you the actual experience, whether in musculoskeletal, neuro, whatever is needed in the fall or whenever it's safe to do so. I just want to mention that.
Thanks so much, Dr. Tan. I said I was going to take your questions, which we will. So if you could get ready to start raising your hands. However, I remember one other question had to do with housing, and of course we know that many of you are trying to decide what to do about housing contracts, and we're fortunate that our student affairs team, particularly Brandon Susselman, has been monitoring this very closely in regular contact with the housing office about matters. And Brandon, I thought I might invite you to make a couple of comments that sort of currently what we know about housing contracts. Brandon?
Also on mute.
You're still on mute.
Yeah.
All right, you can hear me now.
Yes.
Somehow I lost my host privileges. I just wanted to share that thank you for submitting the questions online, because that's the only way for us to know things that you guys are dealing with. So keep those coming. I was able to reach out to the housing office and confirm that if something changes between now and the start of block 6, and you had either renewed your housing contract to say you're staying, or re-up your housing contract saying you're moving back in if you've already moved out, to that they're basically saying that they're going to be completely flexible with those things. So make sure you confirm your details with the housing administration directly, so that you're not caught with any surprises. But one thing that they just wanted me to emphasize was, if at any point you're not in housing and not paying rent, that they want to make sure that you're not expecting to keep any belongings there, and that you would vacate your unit entirely. But they definitely understand that there's changing circumstances, and will be super flexible with you guys moving forward.
Thanks so much, Brandon. And I would just add that I think as folks, you think about your individual circumstances, if you have unique wrinkles to your situation, I think Brandon's a great source of information to be able to sort that out. So now we are open for your questions. Again, as a reminder, if you have a question, raise your digital hand. Ashley Seamer will call on you. Here's the instructions again. You just go to the participant bar, click on that, find yourself on the participant list, and click the little blue hand. Your hand will be raised and you will be called upon. So Ashley, do we have a first question?
It does not look like we have a question yet. Folks,
Okay.
if you want to raise your hand, we'll go ahead and give you a few minutes or a minute or so to raise those digital hands so we can call on you.
I will pass a little time as hands are going, because I do have a few other questions that haven't been asked by as many people but might be of interest. So of course you're all aware of the summer plans. We're very grateful to Dr. Linda Baum and Shamar Jones for the work and pivoting all of your STTP and other related summer activities to remote activities, and literally everybody's plugged in now, which is fabulous. And one question has been about the Josiah Brown Poster Fair, which we typically hold. Like many events, we're kind of taking that sort of on the list of pending, trying to make sure that we have more intel about what that might look like. I would say that many of you know this, that for Senior Scholarship Day, we had great success with a remote version, but we haven't decided definitely at this time whether we'll do a remote version of the STTP Josiah Brown Poster Fair or not. But stay tuned. We're actively talking about that.
I'm still not seeing any hands. Please don't be shy, folks. This is an opportunity for us to connect. So please be sure to raise those hands so we can call on you. Oh, we've got one. Okay. So our first question comes from Rose. Rose, I'm going to go ahead and unmute you so you can ask your question. Hang on just 1 second.
Hi, everyone.
Hi, Rose.
So my question was just regarding like summer anatomy dissection and like planning for some of those makeup sessions for anatomy, just getting into the lab and looking at the cadavers and what the bodies look like. And I'm just wondering if we have any clarity on when we could go back to doing that.
Yeah, thank you. I'll make a couple of comments and I'll ask Dr. Tan to add or Ashley Seymour to add. So yeah, the general plan is that the Dr. Stark is looking at being able to do both anatomy review sessions, anatomy reassessments for folks who need to do that, but also the summer anatomy program. It's in sort of the category of things that we're planning to do live if we can, but also preparing to do remotely if we must. So with that, I'll see if Dr. Tan or Ashley Seymour want to add anything further.
I can add something. I know that many of you have signed up for the section with Dr. Stark in the first 3 weeks of June. We've been in touch with Dr. Stark. In fact, she's here today and she can make a comment if she wishes. The plan is for us to see how the stay-at-home order kind of evolves over the next few weeks. And we're giving ourselves up to the mid-May. Hopefully that will be enough time for you to decide whether you can attend or not. Hopefully by mid-May we'll have an idea of where the stay-at-home order for the state is, and then before we decide whether we can go on with the anatomy dissection. I know many of you are interested in doing that. We just have to kind of see whether we're able to do that safely. Dr. Stark or Ashley, did you want to comment about that?
Yes. Hello, everyone. Well, we are planning as if it was happening, and then if we need to modify plans, we will. But we will be ready to start the first week of June. Everything is ready. We've been doing all the work, and then we'll wait for the go-ahead, as Dr. Tan said, by mid-May or so.
Thank you, Dr. Stark, and thank you for your flexibility with all this. You've been a great partner in this work.
Yes.
Do we have another question, Ashley?
I am not seeing any hands, but please feel free to raise those blue hands. Oh, we've got one. Okay. So Gabrielle is next on the list. Go ahead and ask your question.
Okay, thank you. I was just wondering what the parameters would have to be to actually have us back by the fall. For example, they've been saying that do we need to get rid of the stay-at-home order altogether for us to come back, or will there be a special consideration if it comes and goes?
Yeah. It's a great question. I'm going to offer a few reflections on it, but I know some of my colleagues, notably Dr. Lehman, who's an expert in this area, may have some other insights. Clearly, I think we all know that one of the factors that we're all monitoring, whether it's for classes or for the School of Medicine, the campus in general, or the city or the world, is the nature of the pandemic itself. And again, I think many people are cautiously optimistic that the governor's stay-at-home order in mid-March may have helped so-called flatten the curve. But we also know that, on the other hand, that this is a virus that's going to be in the population for at least the next couple of years. There's all kinds of things on the horizon, vaccines and such, but we know we're going to have to essentially move into not back to normal, but sort of a new normal. And there's a lot of, I think, active talk about what new normal means in terms of how do you sustain social distancing that doesn't translate to stay at home for 2 years. And from the standpoint of an educational program, we're thinking really hard about how can we imagine in our mind's eye education moving into this new normal, whereas on the one hand, respecting the need to mitigate a pandemic that with a virus that's going to be around for some time, while at the same time trying to reach some semblance of continuity. We also recognize that we're all deeply grateful to the faculty and staff who have worked tirelessly to pivot from our usual curriculum to this remote version. And I think many of the things that people have come up with are incredibly creative, educationally impactful, and in some ways as good as, if not better than, their prior alternatives. At the same time, clinical skills is a great example. There's no real substitute for clinical skills than being able to practice that psychomotor skill and refine it and improve and get feedback on it. There's really no way to replicate that remotely. So I would say that on a local level, where Dean Martin meets with the leadership of the campus regularly, and they're talking about things at the campus level in terms of the campus climate. Like the campus is following, of course, the governor's stay at home, the public face coverings, et cetera, et cetera. And we're trying to translate that, what it means for the School of Medicine. May 15th, as everyone knows, is the current stay-at-home order. I think it's speculative to wonder if that would be lifted then and what might happen after that. But as we look into the summer, the prospect of having some new normal that might involve some evolved version of social distancing that allows individuals to do activities with some precautions that greatly reduce the risk of transmission, particularly between asymptomatic people. And we're already seeing some of these practices start to become more normalized. So, for example, many health systems, including Ronald Reagan Medical Center, are doing symptom screening of all healthcare workers, temperature monitoring, and then before, like when I go on service next month, I'll have to be putting in my symptoms and getting my temperature measured. When I arrive at the door, there's universal masking, really intended to reduce inadvertent transmission from asymptomatic infected folks. But those are just a couple of examples. Our ability to, a lot of questions come up around testing. And I'm not going to go into depth there, but I think that as testing becomes more widespread, it has actually helped. So again, in the health system, in a kind of a closed environment, testing all patients before surgery greatly informs decision-making about the timing of surgery, the level of PPE needed. Many places are now, including our UCLA Medical Center, are testing all patients at admission. Again, really helps to manage things. Antibody testing is getting a lot of attention. Again, I'm no expert. Dr. Lehman may add some expertise, but I think largely it's a little premature to know how antibody serology testing will help. I think that many are hopeful that it might indicate some protective immunity, but we know just from Bayes' theorem and pre and post test probability that with a virus that has relatively speaking low population prevalence, that positive serology won't really guide us much to know whether it's a true positive or a false positive. But there's also very little known about whether those antibody levels, even if they are true positive, how protective they might be. So I think that all underscores what I said at the start, which was that it's recognizing that we're in a period of time for the next couple of years at least, if not longer, of needing to adapt a new normal. And it's in that context that that's our kind of, I guess, our mindset is we'd like to be able to start doing the things we need to do in our program in this new normal fashion. Dr. Lehman, I don't know if you have anything you'd like to add or any other folks on the call.
Yeah, I would just say I echo what Dr. Braddock just said. I mean, I think, if you look at where we are now compared to where we were 4 weeks ago or 5 weeks ago, we've already come so far, learned so much. We have so many more tools. So if you can only imagine where we're going to be a month from now, really, which is just, 3 weeks into May. And then if you think about all the way to August, I think we have no way of predicting what's going to be happening then. And I think, it very well may be that we have some graded return to some activities that we're all looking forward to, small group sessions and such, or it may be that we need to stay remote for a while. And we are certainly finding ways to do that with technology. And I think I'm grateful as a doctoring one tutor to have that technology so that I can see my small group at least, remotely on a regular basis and meet with you all in that way as well. And then, as far as, testing, I think, again, there's a huge amount that we're learning and doing every week. We're getting more information. I think Dr. Hoffman's on the call as well, and she certainly can comment with that as well. I don't know, Risa, if you want to take a stab at helping to explain what's going to happen in the next few months.
Yeah, I mean, I think I just want to echo what you guys are saying. It's, the progress has been tremendous. And I think we're, in a good place in terms of, again, all the tools we have available, our ability to test at least locally here in LA, which is going to really, I think, be key to helping us try to return to some sort of normal. And I do think the antibody test is something that could turn out to be really helpful. Our microlab director, Omai Garner, who you all know, is incredible, and he's creating an in-house version of that test that he's hoping to launch next month. And I think we all, appreciate, the skill he brings to that, and it will give us a test that's our own, that we understand. So I think that's going to be really helpful as well. And also lots of clinical trials, lots of information about treatment becoming available. And, we'll continue to learn. So I think, hopefully can be optimistic that we're going to be in a better place in the late summer, early fall, and, be able to resume at least some of the normal things that we all want to start doing again.
And I would just say that for Block 6, which you're all looking forward to when the school year starts up again, I think you're incredibly well positioned with your block chairs, who are really at the forefront of the pandemic, and it's really a fortunate seat for you all to be in. And so that's something to definitely look forward to. Your Block 6 is going to be really forever changed, and you're going to be really at the benefit of learning from these two infectious diseases leaders, among others.
Yeah.
I just
sign up and sorry.
No, I just wanted to add one thing which is that, it follows up on what Drs. Braddock and Lehman and Hoffman have said, which is that it has been incredible to see at the School of Medicine the ways in which faculty, trainees, staff have come together to really accelerate developing effective testing, clinical trials. So it's the tools and technology, but it actually has also really changed the way that research communities are coming together, I think, in a way that's going to change how we confront and how we work pandemics in the future, and how we work going forward in a much more effective manner.
Yeah, and thanks for mentioning that, Dr. Martin, because I think, again, for all of you to know that it really is quite remarkable how the people across the spectrum of different areas of research have come together to kind of put their minds and their efforts together. And this is something that will be going on for some time, and presents an enormous opportunity for those of you. Many of you are probably already thinking about ways in which your career may be changed, areas of interest for you, in terms of clinical practice, in terms of research and discovery. There'll be many opportunities for you to have an impact on this particular pandemic, but also future pandemics. We've realized through this that our curriculum can be and now is enriched with understanding a physician's role and how health systems respond to pandemics. We have introduced a new program for the current MS3s, rising MS4s, as well as those who are graduating, to familiarize them not just with COVID-19 from a biomedical standpoint, but contagion control, principles of personal protective equipment, et cetera. And so that's something that will be a lasting legacy of this time that we can look back on. Dr. Perkins, who's I don't think is on the call, she and I were talking about remembering that when we started our careers, not to sound like an old person, but when we started our careers, universal precautions was not a thing. Universal precautions happened during our career, and it happened because people began to recognize that the uncertainties of being in a clinical environment, performing procedures at the bedside, et cetera, was such that you needed to have the mindset that any particular patient could potentially be could transmit a contagion, And as such, it led to the advent of universal precautions, which now is the norm. And it's this example of sort of recognizing the new normal. As we understand biology and disease, and we understand principles of epidemics and pandemics, it causes us to revisit our practices, adapt like universal precautions, and be prepared for what's coming in the future. Okay, other questions, Ashley? Ashley, you're muted.
Yeah. So I'm just looking through my personal messages because there are still no hands raised. So the first message is regarding the service of gratitude, and if we're planning on having that virtually or remotely, or if it's canceled altogether.
Yeah, thank you. I'll just say a couple words, and I'm grateful that Dr. Stark is on. We'd love to hear your thoughts as well. As we've looked at all events that typically happen in the year, we've tried to ask ourselves the question of which things can we do and do at a high level and do them remotely. But there are some events where we believe that the magnitude of the event is such that a remote event may not be the best fit, and in those instances, we're trying to think really hard about when we can do such events. And that's sort of our current thinking with regard to this activity, because it is such a deeply meaningful activity for all involved, the families, the students, the faculty and staff. And so again, Dr. Stark, I'd invite you to add to that just in terms of our current thinking.
Thank you, Dr. Braddock. I couldn't have said it better. I think that we are looking into either rescheduling for the fall, if that's possible, or even for next year, combining the families of our donors for both years. The families were told for now that it was canceled. Obviously, many of them come from out of state, so there was no way for them to fly to LA or etc. So I think we will be looking into rescheduling it for later in the year or for May of 2021.
Thank you. Ashley, do you have any other hands up or any other questions that came in on the chat line?
So I don't have any other hands raised. Please, everybody, keep raising those digital hands if you want to ask some questions live with us. I do have one question regarding the step 1 deadline, and if it would be postponed for this class as well.
Yeah, okay, thanks. That's a good question. I would say that, well, the step 1 deadline for the current MS2 class was revised primarily because they were unable to take step 1. As many of you know, the testing centers that exist that run the USMLE step exams for the National Board of Medical Examiners, they closed. And so it was literally not possible for students to schedule those exams. And the prospect of when those testing centers might open was unknown. As that time horizon began to move out, we realized we needed to provide, we needed to change the current policies for step 1 deadlines for this current, the current MS2 class, rising MS3 class accordingly. And that's why their deadline was changed. The policy that changed, that was enacted, that we recommended, it was enacted by the faculty executive committee, was for this class only. We're grateful that we've heard that the Prometric company has indicated that there will be reopening testing centers around the country beginning May 1st. There's a little bit of a regional sense to that, so we don't know exactly what that'll mean here. I might ask Dr. Miller to comment more in a second. But the idea is that May 1st and beyond, again, back to this, getting back to a new normal, we anticipate that one of two things will happen. Either testing will be conducted in testing centers as it has, with appropriate social distancing, et cetera. Or it's also possible that testing may move into a remote environment. Probably heard about this from upper class colleagues who are taking shelf exams remotely. The first one, I think, was yesterday. So this is a new methodology for the NBME. They haven't done it previously, but other boards do remote testing with remote proctoring. In internal medicine, as you know, the American Board of Internal Medicine began doing remote testing with remote proctoring a couple of years ago for completely different reasons, but there is technology to allow it. So it's possible that that may be a solution in the future. But to your question, the step one policies for your class would be the usual step one deadlines and would not be the deadlines that were put in place for this current MS2 class. But Dr. Miller, do you want to comment any further?
No, I think you've said it all. Just that we recognize that this has been a time of great angst for the second year class. These folks were on schedule with their deep preparation for the step one exam and got thrown for a tremendous loop with the closure of the Prometric Center. So many of them will continue are going to take it at the beginning of the year if Prometric opens as we anticipate, and some are taking it at the end of the year. And we appreciate the flexibility afforded by the Faculty Executive Committee for the current second year class only.
Thank you. Looks like we have at least one hand up.
Yes, our next question comes from Gloria. Gloria, go ahead and ask your question.
Hi, I know clinical research was temporarily put on hold a couple weeks ago. Do you have any insight on when clinical research will resume and in what capacity, especially over the summer?
Yeah, sure. I'll be happy to start things off, and I'm going to ask Dean Martin to comment because she has been catalyzing an effort to really look very carefully at how to, both for the COVID-related research and other branch points, but also more generally how to reactivate the research enterprise. But that's basically, I think, the plan for the summer for your particular activities. We went into the planning of STTP and related activities under the premise that we were uncertain whether this summer there would be sufficient likelihood of you being able to do in-person research, that we just made a decision to do it all remotely. But in the research community more broadly, I'd invite Dean Martin to make a few comments.
Thank you. And it's a great question. It is something that we're working on here in the medical school, on the campus, and actually broadly across the country in terms of how are we going to do what we're calling a research ramp up. So how do we get back in the business of doing research in a way that's safe? I don't have answers about timelines yet. I can, the kinds of parameters that we're looking at have to do with the ability to ensure social distancing in research activities, the ability to have testing for researchers, for COVID-19 testing. Those are some of the things that we're looking at and trying to think about when we will be able to bring back researchers, with the recognition that that work is critical in many cases for work on other diseases, for insights that are going to be critical to how we practice medicine in the future. So it is something we're looking at closely. There are the latest that came from a conversation today with the research deans with the AAMC was that people are, looking sort of towards that end of May, June. But again, so much depends honestly on what happens with this pandemic. And obviously that's a biology of viral transmission and epidemiology that we don't have control over as human beings. We have control over how we respond to it, but within those parameters, those are some of the criteria that we're looking at to try to look at when do we do this research ramp up.
Just as a follow-up, Dr. Martin, you might say, I would imagine that for the COVID-related work that there may be some earlier opportunities for students who are interested to get involved.
Yes. So there is all of the research activities right now, they're not completely stopped. There's essential research activities that are ongoing, and they're ongoing under conditions in which the researchers are wearing PPE and practicing social distancing. And those essential activities include work on COVID-19. And so there are clinical and basic science and translational work on COVID-19 that is ongoing and that is permitted to be ongoing. And then the other essential work falls under a variety of other categories of experiments that maybe have been going on for a year or 2 years, where that would be lost if it were stopped at this moment, or personnel who need to go in to maintain the ongoing activities of a research laboratory. Again, all being done under conditions of social distancing and proper PPE.
Thank you, Dr. Martin. How are we doing for questions, Ashley? Any further?
We're doing great. I've got a few more. So
Okay,
the next
excellent.
one is regarding the Josiah Brown Poster Fair, and if it will be done, and if so, will it be done remotely?
Yes, so I'll just, as we were saying earlier, the Josiah Brown Poster Fair, where we are right now, is deciding whether we would follow the model that we did for the Senior Scholarship Day and do a remote activity, or whether we might defer it. The main reason with the Senior Scholarship Day to do it remotely is realizing that the seniors have had a finite window of time in which we might really be able to display and really pay tribute to their work and the scholarship that they created. With Josiah Brown, it is a wonderful event. The family that supports it is incredibly been supportive over many, many years. And it's a wonderful opportunity not just to share your work with your colleagues, but we have summer programs typically where, honestly, I have to tell you, as you know, maybe you know, I direct the Summer Health Professions Education Program, or SHPEP, partly funded by Robert Wood Johnson. It's a pipeline program for pre-health students, pre-med, nursing, and dentistry. One of the most high points of their experience is being able to go to that poster fair and meet the folks that they aspire to be in a few years. So you know that we won't be able to do that this year, but the question is going to be whether we will do something. Honestly, if I knew what we're going to do, but it likely will be a conversation with the folks involved in SCTP. We'll likely also get input from all of you on that as to the relative desirability of a remote kind of poster session versus something we might do later. We would have a little bit more option to do something later, just because you guys will be around a little bit longer. But we also realize that the fall semester gets ramped up, and all of a sudden it's hard to find time for things. And so right now we're in the process of deciding that. How about the next question?
So the next question is regarding, sorry, I'm just scrolling here. Shadowing. So the students are expressing that they're still determining which specialties interest them, and will there be an opportunity for them to further shadow or explore the opportunities, and if we're working on a formal policy regarding clearance in the hospitals.
Okay. Well, I'll start, and I might ask my colleagues, Drs. Miller-Tan or Haw, to add. The short answer is that right now, of course, today we're straddling the balance between social distancing, respecting the stay-at-home order, and then returning students at various levels into the clinical environment. The first group we returned to clinical environment were the MS4s. The current MS4s and then the rising MS4s will be in clinical roles doing direct patient care with a few caveats. We're getting assurances from the site that they can have adequate PPE and that, to the greatest extent possible, minimize exposure to COVID-19 positive patients, but they're already right now in the clinical environment. The next will be the MS3s, who are, as you've heard, will be starting the rising MS3s will be starting their clerkships remotely, but with the hope to return them to direct patient care activities with the same provisos as early as the end of June. Again, all depending, as you've heard us all say, on the nature of the pandemic and other factors. I think as we think about you as rising MS2s, the main two things that are in focus are clinical skills, as we talked about earlier, during your second year, preceptorships, and of course the other kinds of things you're raising, shadowing and other kinds of clinical opportunities. Where I would say right now today, I would describe myself as cautiously optimistic, as I said at the top of this, that we can return to some new normal with regard to having you be able to do some direct patient care of that sort, preceptorship, clinical skills, but it's going to be modified from what we typically experience. It's going to be modified by the need for some level of PPE or at least some precautionary masking. It's going to be dependent on the site and setting, but it's our intent, if things go well, that we can do that. And if we can't, we will pledge to you that we'll create opportunities as time moves on to make sure that you get both the exposure and practice you need to be prepared for the next phase of training, but also, just as you're raising it, make sure you're getting ample opportunity to explore, as Dr. Miller likes to say, to taste different specialties to inform your future choices. But Dr. Miller, do you want to add anything to that?
Only to say that, of course, we don't know the answer to when we'll be able to have get shadowing opportunities off the ground again. But I think it's important for you folks to know that we recognize how important it is that you have these experiences for career exploration or taste testing, and we're committed to providing those experiences for you when we can.
Thank you. We have about 5 minutes left, maybe time for one more question, if you have one, Ashley.
I do. So the last question we'll take is regarding the block for block 5, and just opportunities to make up the neuroanatomy labs, since they do the brain dissections during that time frame. And so will there be opportunities for that makeup?
Yeah, great question. I know that Dr. Stark is here. I know Dr. Hauser is here. I don't know if either of you would like to comment or in response to that question.
Well, this is Elena Stark. I will let Dr. Hauser talk about the brain dissection, but for the rest of the anatomy, we will, as I said earlier, we are ready to go. We have all the specimens, all the cadavers dissected and ready to go whenever we are given the green light for students to go into the lab. We will be having as many labs as needed, including over time. So we will have plenty of opportunity for all the students to come to the lab and make up for, seeing the specimens 3D.
Thank you. Dr. Hauser, I don't know if you want to add anything further in terms of as a block co-chair.
Well, since they were asking about block 5, I would say I really feel that the labs as they're planned are exceptional if they're actually looking at all the material and all, and they'd be surprised. They'll probably get almost as much out of it as actually working on the brains in some regards. But if at all possible, if we can find the time, either this summer or as everyone's talking about in the next year, we can certainly make some pro sections available and the ones that have been used in the actual demonstrations, and also a lot of additional material that's usually available in the block. And this would be something that probably they could come in and do work on their own. And I think that would work to help round things out.
Wonderful. Thanks so much. Thanks for all of your hard work. We all know how much effort you and your colleagues and the other block chairs have put into migrating what's a wonderful instructional experience into this format. So thank you. We're about at our time. So I want to thank all the panelists, the deans, the faculty, the staff for pulling this together. I wanted to offer it to Dean Martin if he wanted to offer a word or two and imparting, and then we'll close things up.
No, I want to thank everybody as well. I want to thank all the students, the staff, the faculty. I mean, as we've said, this is a situation that we really can't control, but we can really do something to make a difference about. And I appreciate everything that everybody's doing to respond to it. So thank you very, very much.
Dr. Miller, any parting?
I'll just say when Deb was talking about block 6, she was getting me. I'm thinking of taking block 6 with you folks. You got me all excited for that. But take good care and please reach out.
Yeah, I just would close by saying thank you to everyone, and echo Dr. Miller. Take care. We have to take care of ourselves. We'll take care of one another. We're here to assure that you have a high quality experience, but also support you to support all of us getting through this. So thanks for coming. Thanks for your questions. Take care, and we'll talk soon.